One of the things that I'm going to be talking about tomorrow is how to scale up training of surgeons in cancer surgery. And one of the tools we're going to be talking about is how we can use very low cost virtual reality tools to help surgeons learn surgical techniques.
Look around the room and tell us what you see, what you hear.
You can hear the EKG or ECG beeping, breathing apparatus, lights. There's a monitor, clock, doors, and then lights, and then a patient.
Okay.
Well, one of the things that surgeons in wealthier, more developed countries have is they have access to virtual reality. They have access to many things that can help them be better surgeons that people in low and middle income countries, surgeons in low and middle income countries don't have. And we want to make sure that we know that these tools can improve their learning of the techniques. It can also reduce errors once they do surgery. And so we want to make sure that surgeons in developing countries have these same advantages. Well, there's a number of reasons that we decided to work with virtual reality. One, we know that it's effective. It's often used in robotics and laparoscopic surgeries. However, these tools are often very, very expensive. And most people in developing countries can't afford them. However, the technology has changed so dramatically in recent years that we believe that with off-the-shelf equipment that you can buy with home gaming systems, we can create a realistic virtual reality that actually could train surgeons to do surgical techniques. We're focused on radical abdominal hysterectomies. And it's the type of surgery that you give women who have early stage invasive cancer of the cervix. The reason that we're focusing there is that it's the #1 cause of women's cancer deaths in Africa. #4 in the world, but in Africa, it's really it's disproportionate. It kills women with cancer. So this is actually the Oculus Rift, and it is the main tool that we use, and it's really kind of neat because it's actually home gamers use these things. And we've been able to sort of use off-the-shelf stuff like the Oculus Rift as well as software to create it. And what the user does is really in the comfort of their home, which is where most people do it, they just sort of put it on, and they then begin to see a surgical world that they can then operate and manipulate with some hand guides that we give them as well. It's an immersive experience, and the more immersed a person is, the better it works because they kind of forget that there's a whole world out there. It's totally neat. Yeah. So there was a couple things that we actually did to help immerse people. Not only did we create an entire world based upon an African surgical suite, we actually had pictures, videos of it, and it is identical in the way it looks. We also have audio from the surgical suite, so when they're in there, they can hear the respirator, they can hear the EKG, they can hear the movement of instruments. They also get regular prompts from a senior surgeon, so that when they do the procedure right, he'll say, "Great job, nice," in order to encourage them on. The response has been really pretty tremendous. We're now testing this with medical students and OBGYN, gynecologic trainees in Zambia. We give them no incentives other than you can use this thing, and they come in day after day after day trying to perfect their skills. And that's really what we wanted. We wanted it to be fun and interesting, so they would do it because they have to be motivated. So you want to make it fun. But we also wanted them to learn how to do the procedures. And what we found is that when people use this, that each session they're learning more and more. Their accuracy improves every single time that they learn it. So there's a couple of things that you want to measure with virtual reality. In surgery, I mean, if you're not a surgeon, when you see a surgery, you're not really sure what's going on. It's very much like dance. Everything is choreographed, and even though it might be abstract or whatever, every movement is choreographed, so you know exactly where your partner is in dance. The same thing happens in a surgery. Every movement should be choreographed because you're processing, you're thinking ahead. What's the next step? What's the next step? Where do I go? What instrument do I use? Where do I use this instrument? How do I use this instrument? So everything is choreographed. So the fewer movements a surgeon makes corresponds to better outcomes. So we look at how many movements do they take to actually do the procedure. We look at how long it takes them. We don't want them to go too fast because they'll make too many errors, but we know that time is useful in certain types of procedures. We also look at how many sessions have they done. We look at how long of a gap has it been between the sessions, because we know that if there are large gaps, it could possibly, your learning could decrease. And we're also interested in, do they think about this in the between times when they're not in the virtual reality? Because we also know that when people think about something or they're engaged in learning the process, when they're not doing the virtual reality, when they come back, they'll be better. Yeah, so one of the things that really is like the next phase of this, one of the things that we know thus far is that, one, we can create the world, and it is realistic and it's believable. We create the world and they want to do it, so they keep coming back. We've also shown that people become much more accurate, have many fewer movements as they learn the process, and the only factor that affects whether they learn it is how many times they've actually done it. And so we can actually get them to a level of proficiency in a fraction of the time that it would take to actually be in the operating room. Our next phase of the study is to do a clinical, we're doing a clinical trial now to see whether you get this surgical virtual reality or another type of virtual reality if you could actually learn the procedure quicker in the operating room. And so that's actually where we are now, is putting this in a clinical, is part of a clinical trial showing that this actually works. The other thing that's been really, really interesting with this project is that because it taps into many different skill sets, no one person or even one team can actually do this by themselves. Our team is composed of virtual reality designers, game designers. I have a background in health systems and how to make health systems move efficiently. We have people who are learning specialists. We have people who are gynecologic oncologists. Putting all these people together helps create a system like the one we've been able to do.